Hello, Patrick McKeown here. Thanks so much for supporting our Buteyko Clinic channel. Can I ask you a big favour? Would you mind subscribing? And with this, we can support the channel more, we can put out more videos, and it would really mean a lot. Buteyko, for me, has been life-changing and life-changing for the people that we're working with, and we would love to see it getting out there. So please subscribe. Thanks very much. Is there a benefit to increasing blood flow to the brain, increasing oxygen delivery to the brain, and also increasing carbon dioxide, lowering blood pH to help reduce brain cell excitability? It's been known since 1924 that when blood pH was a little bit too high, that it could trigger epileptic seizures with persons with epilepsy. And it was due to increased neuronal excitability. So this little conversation here is about how can we impact brain health by changing breathing patterns. And if I was to say, what is the most direct way to increase blood flow and oxygen delivery to the brain and calm brain cell excitability, it's not by slowing down your breathing. It's not by taking full, deep breaths. It's by breathing less air. Now, I know that I'm distinguishing between slow breathing, and it's not that slow breathing is bad, but just focusing on the respiratory rate is not enough. You could, for example, slow down your breathing, but in the process increase your tidal volume disproportionately, that your minute volume increases disproportionately. And that's going to have a negative impact on blood flow to the brain, oxygen delivery to the brain, and brain cell excitability. So if our objective is to improve blood flow to the brain, it's about breathing less air. We breathe less air when we lower minute volume. How do we lower minute volume? Well, what is minute volume? Minute volume is the volume of air that we are taking into our body across 1 minute. How do we calculate that? It's the respiratory rate, which is the number of breaths per minute, multiplied by the tidal volume, which is the volume of air that we draw into our lungs during, say, for example, 1 breath. Normal minute volume would be a respiratory rate of about 12 to 14 breaths per minute, a tidal volume of 500 mil or 600 mil, and that would give us a minute volume of about 6 to 8 litres, 6 to 9 litres, give or take. So many of us breathe too much air. We are breathing a minute volume between 10 and 15 litres. And that has been shown by different trials, and especially with asthma, for example. And you could even wonder, well, how is it that somebody with asthma, they feel that they're not getting enough air, they have narrow airways, but at the same time they're over-breathing? And yes, that's correct. And it's their over-breathing which is feeding into the narrowing of the airways. But anyway, coming back to brain health, we want to increase blood flow to the brain, oxygen delivery to the brain, and we want to reduce neuronal excitability. The objective there is to breathe a little bit less air. Because if you breathe a little bit less air, carbon dioxide accumulates in your lungs, and the reason being is because you breathe less of it out. If you breathe less air, you don't breathe out so much carbon dioxide, you hold on to a little bit more carbon dioxide in your lungs. If you increase carbon dioxide in your lungs, in the small little airways in the lungs, small little alveoli in the lungs, with the increase of carbon dioxide in the alveoli, naturally, by diffusion, the increased carbon dioxide will go from your lungs into the blood. This blood then is the blood leaving the lungs. It's going to the heart, and then the heart is going to pump this blood throughout the body. So if we breathe less air, within about 30 seconds to 1 or 2 minutes, it's a short period of time, we can increase blood flow to the brain. Now, I have shown a couple of videos in terms of breathing less air that you can go a little bit deeper into it, but in a very simple instruction, if you're sitting there and if it's safe to do so, take a very, very soft and slow, gentle breath of air into your nose, and a really relaxed and a slow and a gentle breath out. It goes without saying that your breathing should be silent. But bear in mind, our objective here is to breathe less air. So in other words, that your breathing volume now should be less than what it was before you started. It's not about just slowing down the breath. Yes, we are saying take a soft breath in, short breath in. So here you were reducing tidal volume. You're taking less air into your body, or you're taking that air over a greater period of time. You're having a really relaxed and slow, gentle breath out. So our objective is, over the course of a minute, over the course of 2 or 3 minutes, you're reducing your minute volume. You reduce your minute volume, carbon dioxide increases and blood flow to the brain increases. And of course, I think the biggest impact that we're having is being able to reduce brain cell excitability. You think of 80 billion brain cells, and each brain cell communicating with 15,000 other brain cells. And if, for example, there is an increase in blood pH, which in turn is very often or most often caused by breathing too much air, a habit of hyperventilation, as would happen if we get stressed or if we have poor everyday breathing patterns. So some individuals, myself included, for 20 plus years, was breathing too fast and too hard, and I always felt my mind was not in the right place. I had too many thoughts going on, rumination of the mind, fatigue, difficulty concentrating, and a higher stress response. And of course, it makes sense if we're not giving the organ that needs fuel. And this is the one thing we have to wonder this question. I put this video out there because I suppose you're thinking about the brain, the most important organ, including the heart. Bear in mind the two of them. We can influence blood flow and oxygen delivery to both of these organs through our breathing patterns. But yet, the breathing techniques that are most often put out there do not increase blood flow to the brain, do not increase blood flow to the heart, do not increase oxygen delivery, do not quieten the mind. Why? Because most breathing techniques, if they emphasize slow breathing, it's not taking into consideration tidal volume, and it's not taking into consideration minute volume. And of course, hyperventilation techniques, which do have their benefits, but then again, if you are practicing a hyperventilation technique, you have to ask the question, what is happening there? What's the benefits? And also think about your normal everyday breathing at the end of that as well. So, brain health, it's not about breathing more air, it's about breathing in and out through your nose, it's about breathing light, it's about breathing soft, it's about breathing slow, it's about breathing less air. Breathe less air, carbon dioxide increases, and as carbon dioxide increases, that is the factor which increases blood flow to the brain. Now leave it in comments if you know of other ways to increase blood flow to the brain by practicing a breathing technique. Always bear in mind what is the primary gas that influences blood flow to the brain. In terms of breathing, it's carbon dioxide. So any breathing technique that involves breathing less air or a breath hold, it's going to allow carbon dioxide to increase. But I would be interested in your take. Surely we should be talking in terms of breathing. In the breathing world, we should be putting it out there. How can we increase blood flow to the brain? Not what's being practiced so commonly, because that's not increasing blood flow to the brain. That's doing the opposite.